This is Hazel from Florida. She is 3 years old and was diagnosed with Bohring-Opitz Syndrome when she was almost 2. Over the first few years of her life, Hazel demonstrated the following symptoms. She aspirated milk while we were in the hospital, and a G-tube was inserted after a month's stay in the NICU. She now eats by mouth, but only drinks from bottles and eats purees. She was born full term, but only weighed 4 pounds 9 ounces and was 17 inches long. She grows very slowly. At age 3, she weighed 20 pounds and is 31 inches long. Hazel is very delayed. She is nonverbal, cannot sit or stand, and cannot do much independently. She was put on medication for occipital lobe seizures when she was 18 months old, but we have recently tapered off to see if she still needs it. Hazel is very nearsighted. She is known for her mint green glasses and has worn them since she was 4 months old. She has hypotonia, which means she is floppy and has very weak muscle tone. Some other interesting characteristics of children with this syndrome are abnormal hair density and length and fingernails that grow quickly. Many children have a heart-shaped birthmark on their forehead. Hazel had a faint half-heart at birth. Also, synophorus, or a unibrow, is a common characteristic, as well as excessive amounts of body hair. BOS children also have small hands and feet. It took over 20 months to find a diagnosis. She was tested for Prader-Willi syndrome and had a microarray screening. We saw many specialists. All tests kept coming back normal, which was both a relief and a puzzle. Finally, our genetic counselor told us that we could get whole exome sequencing. When our results came in, we were told that our daughter had Bohring-Opitz Syndrome, which is a spontaneous mutation on the ASXL1 gene. Hazel's syndrome is very complex, and we face many challenges. We are currently focused on communication, mobility, and independent feeding goals. Hazel goes to a school for special needs, and we get occupational, physical, and speech therapy, as well as hippotherapy, aquatherapy, and conductive education classes. We want to encourage more research on BOS in Hazel's lifetime, and hope to see the quality of life improved for our little fighters. We know that Hazel will always depend on us, and we are happy to have such a sweet little girl in our lives.